everyone, and welcome to Shift Report. I'm your hostess, Janie Garner, and I am here to talk to you about being fired for protecting your patients. Yes, ma'am. That is what I'm here to talk to you about. It is February 12th, Monday, at 1900 Eastern, and if you are watching this at that time, it's now, and we're live, and there's a little red box in the upper left-hand corner, and if there isn't one, we're not live, but I'll try to answer your questions later. I'm going to add to the cast Theresa Ward Puckett, who is going to tell you a story. And we may bog down. Hi, Bradley. Hello, Theresa.
Hello.
Hey, so we may bog down a little bit because there's two of us on the cast, but don't worry, it won't be too bad. Hello, Gail. Hello, everyone. I'm so glad you guys came. This is Theresa Puckett, Theresa Ward Puckett, who basically has had some very interesting changes in her life recently, courtesy of her employer. And you know that I am always trying to bring these things to your attention. Hello, Sheila. So, Theresa, why don't you give me the one-sentence answer of what happened to you? What happened?
I was fired because I got sick.
Okay, so we have a nurse here. Theresa, give me your educational background.
Sure. I have a PhD in nursing, so I went to nursing school for 15 years. I have a bachelor's, a master's, a postmaster's, and a PhD.
Okay, so Theresa is a PhD, and also, what's your other job?
I'm a professor of nursing at a large state university in Ohio.
Okay, so Theresa is not only a nurse with a PhD, but Theresa is a nursing professor at a major state university. Mm-hmm. And Theresa, who is obviously a good citizen in nursing, was fired for protecting her, essentially for trying to protect her patients and for being sick. So Theresa went to work the first day when she was ill, right? The first day that you were really ill, you called in, right?
I called off, right. I woke up on the morning of like the 28th of December, and I knew I had the flu. I mean,
right.
And yes, of course I had my flu shot. People are like, oh, she must not have gotten her flu shot. No, of course I did. Like, it's required.
I got mine.
Right. It's not required at my hospital. Like, you can actually not get it and wear a mask, but it is required by the clinical agencies that I teach clinical for through my job at the university. So yes, of course I got my flu shot. So I woke up on the 28th, like super sick, like chills, achy, nauseated, everything like that. Being the nurse that I am, I didn't run to the doctor because, like, who does? And so, yeah, like, who does? So I nursed myself for like 2 days, and I thought to myself, like, I'm not getting any better, right? So I went to the urgent care, and in fact, it's interesting. I ended up laying down on the bathroom of the urgent care because I thought I was going to pass out. And
God.
I know, I was nauseated, so I ran to the bathroom to throw up. And then while I was doing that, I just felt so, like, the room spinning, that kind of thing. And so I just end up laying down on the floor of the urgent care bathroom, which was disgusting. And
I bet.
Ooh, I know. I was like, I got to wash my coat, as soon as I get home. But anyway, I was diagnosed with flu. I ended up getting a prescription for Tamiflu. And I ended up missing 2 days of work. Now, mind you, I'm PRN, so it's not like I was scheduled 5 days in a row or anything like that. But I ended up missing 2 days with that that was covered under that doctor's note. So then I'm scheduled to work again, and I had been sitting around my house thinking, oh, I'm feeling slightly better, sitting on my couch in my pajamas. And so, maybe I can, like, drag myself in there as long as I take all my stuff with me,
Right.
And
which is what we all do.
Well, I had the Tesla Pearl, plus the Mucinex, because I've read somewhere that you can use those in combination. So I'm like, let me do that. And then I had, like, the cough drops and all that stuff. So at the beginning of that shift, I had seen my nurse manager, actually, and I gave her my doctor's note from that incident, and she said, thank you. Like, never at that time did she say, well, that doesn't mean this is excused. Never at that time did she say, well, listen, I have this write-up for you because you missed an occurrence. Those 2 days are one occurrence because they were two consecutive days. Yeah. And never did she say, like, sign this, nothing. And so I just was going on my happy merry little way, and that shift sucked because I was coughing. I was coughing all over the place. I was at the point where, like, I knew I probably shouldn't have been there, but when you're sitting at your house, it's not the same as when you're up, like, walking around somewhere. Do you know what I mean?
Oh, totally different, Theresa, because I'm currently getting over the flu.
Yeah.
And I went back to work today, and I'm going to tell you, by about 11 a.m., I felt like death. My coworkers were like, why don't you go home? I was like, I'm just going to sit in this chair. It'll be okay. Because I'm not contagious anymore. But, I get it. That's what nurses do. And it's not good that we do it, but that's what nurses do. So then what happened after that, Theresa? Tell me what happened next.
So my charge nurse that night, I was working evening shift. So I was working 3 to 11:30. And my charge nurse is like, look, if it's not busy later, when you're done with your HS meds, if we're not getting any admissions and it's still kind of slow, like, why don't you go home? And I'm like, are you sure? Because when do you ever get to go home early from a shift, no matter how sick you are, right? And so obviously, like, I really was bad off because I was being sent home. So I passed my HS meds, and I was done, like, early because I started at, like, 8 o'clock. So I'm done by, like, 9:30. And I checked in with my charge nurse, and he goes, yeah, like, we'll be okay for a couple hours. I'm like, all right. So I go home. So a couple days later, I'm scheduled to work again, and I'm like, all right, well, I've got to be better, right? Because as nurses, number one, like, I don't get sick that much, and when I do,
you have the immune system of a cockroach.
Yeah, so, like, you get sick for, like, a day or two or something, so I'm like, all right, like, I've got to be coughing less and whatnot, right? So I go back that day. It's another, like, shift from hell because I'm, coughing so much. So it really prompted me to go back to the doctor because I'm like, I'm not getting any better and this is weird, And my husband even said to me, he goes, for you to go to the doctor in the first place is crazy. For you to go a second time is really unbelievable, I mean,
you weren't spurting blood from your eyes, so how could a nurse go to the doctor twice in a week?
Correct. So, yeah, that's exactly it. So I went back, like, so I worked that evening shift. I went back to the doctor, like, I went to, like, a CVS Minute Clinic, actually, with a nurse practitioner. That next day, and I said, look, the chills are kind of gone and that kind of thing, but I'm still really dizzy. I'm having these dizzy spells, and I keep blowing my nose and everything. I said, usually when I'm dizzy like that, I have the sinus infection. I go, I wonder if I have something bacterial going on top of the flu. And so she looked me over and all that, and she's like, yeah, I think you have bronchitis and a sinusitis. She goes, I'm going to give you Augmentin. And she wrote me off because, when you're started on an antibiotic, you're supposed to stay home for the first 24 hours. So I was supposed to work that night. So I had gotten another doctor's note. This is doctor's note number 2, which I got from the nurse practitioner. And that I missed that evening shift that night. 2 days later, I get a text message. This is how valuable I am to this organization, right? I get a text message from my assistant nurse manager saying, I pulled you off the rest of your scheduled shift this week. A text message, people. I was there for over 4 years. I never had a corrective action. I never called off. And I get a text message from an assistant manager. I'm like, this is amazing. And so I text him back and no response. I called him, no response. It was then kind of the end of the business day. So I called my manager the next day, and she said to me, I hate having these conversations. And I'm like, oh my God, like, did I hurt someone? That's your first thought.
Right.
Like,
I killed somebody.
Yeah, like, I made a medication error, like, of gargantuan proportion. And I said, well, what's going on? And I put it on speakerphone because my husband was home, and I said, I want you to hear this because I don't really, like, I'm mouthing to him, like, I don't know what's going on, And so I put it on speakerphone, and so she said, yeah, we have to terminate you. And I'm like, wait, what? Like, what's that? And she's like, yeah. And I said, well, what's the deal? She goes, well, according to the PRN policy, if you have 2 occurrences of absence in a 60-day period, then you are terminated. And I said, well, wait a minute. I said, I actually have a copy of that policy, and it actually says may be terminated. Well, she took over being our manager 2 months prior. Prior to her, we had somebody for 12 years in the position. But the hospital was making cutbacks, I think, of, like, senior nurses. Yes, that were making a lot of money. Yes.
Wait a minute. People who made a lot of money, they were firing them?
I know you've never heard of this before. So they were firing managers and then making kind of like your newer, less senior managers over multiple areas. So she had about 2 months prior taken over our area as an additional area, and she'd been a manager just for like a few years. But anyway, I guess like she felt that when and this is what like she told me, and HR did tell me this when I talked to HR after I talked to her. HR told me that like when she took over, she decided that she wanted to be really like black and white with the policies. So as far as the 2 occurrences in 60 days, instead of it like maybe she didn't want like me not getting fired for that, but the next person getting fired for that. So she decided to follow that to the T of 2 occurrences in 60 days, you're done. And I thought when she told me this that there had to have been a confusion, because I'm like, I know I haven't called off like forever. And actually, I have a paper planner, and I always document like what shifts I work, so I can figure out like what my paycheck's going to be and stuff.
Right, because if you didn't chart it, it didn't happen.
Well, that's
right. I know. Go ahead.
Yeah, and because I'm sporadic, like with PRN, I want to know like what my paycheck's going to be. So, you know, if I get canceled for low census, which hardly happens, or you know, if I call off, I'm going to document that. So I went all the way back through like December, no call off, November, no call off, October, no call off, all the way through, and I didn't find any call offs in 2017, which I didn't think there was because I'm money hungry. Like I work 7 days a week, multiple jobs because I've got 4 kids, I got a grandkid. Like I do not call off. So anyway,
and grad school stuff and. Yeah,
I mean, like I'm teaching. I teach, you know, I teach clinical at multiple facilities. I teach online. Like I just do all this stuff, and yeah. So it's just, and I have like another PRN job too. And by the way, they were fine with me being sick. They said thanks for not coming in. I work at my other PRN job is a residential treatment facility for kids with autism and like mental health issues. Yeah, no, and they were fine. Like I still have that job.
Right.
Well,
so
anyway.
Theresa, let me go into the specifics. So you didn't have an absence problem. You've been working at the facility for 4 years.
Yeah, and actually I've been at that particular hospital on and off for about 20 years. I started there as a nursing student in organ transplant, and then I worked in the PICU. After school, then I graduated and I accepted a job at NICU, and then NICU stepped down. They were like connected, so I would float to either one. You know how that is.
So NICU feeder grower.
Yeah, exactly.
Yeah.
And then and then I end up finishing my master's degree in child and adolescent health nursing. And so I got a kind of like a PRN position as a nurse practitioner in a clinic, and was going on for my PhD. And at that time, I was starting to teach. So I really, it was hard for me to keep up the bedside thing with getting my PhD. So I left that for a little bit. But about 2 years later, I came back to University Hospital because they were opening a peds psych unit. And I'm like, I want to do.
And that's your thing.
That is, and a lot of my friends were like doing it.
I have to tell them the funny part. Guys, Theresa Puckett, when I met her, I said, God, I know this name. What is this about? And a lot of you guys know I'm trying to get my master's, right? I cited her dissertation in my, in one of my incarceration of juveniles, you know, implications, mental health implications. I cited her dissertation in it. That's why I recognized her name. It's such a small world in nursing. Okay.
It really is, and you know that just it was hard. That getting IRB permission to survey incarcerated juveniles. Like my PhD took 8 years. So it's like so aggravating to me when people are like, oh, she was some slack off nurse. It's like, do you understand? Like, I have so much invested in this career. Like, I have been in nursing for over 18 years. This summer's like 19 years. I've been a nurse educator for 15 years. And I actually have like $1 million of student loans because of going to all these like educational programs. I mean, I have like a ton invested in this. And so, you know, I'm not, you know, I thought long and hard before I went to the local news about this because like I have a reputation, you know, and I knew there was going to be some sort of, you know, backlash. I mean,
and a good one because I looked you up.
Yeah. Do you think like a hospital wants to like hire me now? Do you know what I'm saying? In fact, I had an interview scheduled for last Thursday, and it was an interview to direct a nursing program, which I've done before. I've been an associate degree nursing program director, but I had an interview set up to direct a nursing program at one of the local schools here, and it was a salary of $105,000. And after my story aired on the local news, they canceled the interview, the second part of the interview process. I had done a phone interview for like an hour with them, and then I was supposed to come to campus, do a teaching demonstration, and have an in-person interview with multiple like levels of administration at the school and with students and, you know, like that kind of thing. And that got canceled because I went on the news. So when people are like, oh, she's just seeking attention. No, I fully understand. Like, I might not teach at my school next year because, like, this is bringing kind of, like, negative to the school. They don't want me if it's, like, I can't teach clinical at half of the hospitals in Cleveland. Like, this is huge that I stuck my neck out like this. I wouldn't have done this for, you know, attention. So it's annoying when people say that. But one, you know, Janie, one thing I wanted to say that I didn't get to is, you know, when I was talking to my nurse manager and I thought there was a mistake, I said, you do realize I have doctor's notes, right? And that's when she told me about the no-fault attendance policy. And the no-fault attendance policy basically means that it doesn't, like, really matter why you're absent. And there's a couple of excused absences, like jury duty, bereavement, approved leave ahead of time, which is a PRN, like, you don't get that, you know?
Right.
And things like that. But, you know, it's just weird to me that, like, a doctor's note is not an excuse. Do you know what I'm saying?
Oh, no, I do. And the thing is like, you and I were talking about this because, by the way, Theresa appears to be my spirit animal. So she and I were talking about this yesterday, and, you know, we talked about the fact that, you know, so many people wanted to say, oh, well, she probably had an attendance problem. I'm like, no, she didn't.
No.
Oh, she's probably just has a shitty work ethic. Nope, that's not it either. I mean, this is a nurse who worked her ass off to get this advanced degree and do all these things, and she never had an attendance problem. It's just that this new manager decided to come out gangbusters and enforce all the policies black and white instead of the way they've been enforced for years.
Right.
And hello, everybody. I'm sorry I'm not really responding to your comments right now because I'm trying to get this whole story out for Theresa and to tell you what we're going to do about it because you know I'm an ass. So, at any rate, this is a public health issue. This is not an employee policy issue. This is a public health issue because if you are allowing your employees to come in with positive influenza active to your, and what kind of floor were you working on, Theresa? What kind of floor was that?
You know what? Honestly, I was only, like, I want to say only, like, I wasn't on a cancer floor or anything like that. I was working on a psych floor. But what you have to understand about that is it doesn't matter. They're going back to
get them all sick.
They're going back to group homes. They're going back to some of them are going to homeless shelters, getting discharged to homeless shelters. Yeah, some of them are getting discharged to nursing homes. You know, not everybody's like going like just back to home. So it's I mean, it doesn't really like matter that it was psych and they weren't necessarily immunocompromised. But the point is I don't think you bring it to work, right?
No. That's the point I'm making. I'm like, where are you working? Oh, wait, let's look at all the implications of what you're doing. You have people who are going to go to other institutions, and we're in the middle of a flu epidemic.
Right.
An epidemic. Right. And we're saying, you know, we've had 63 children, I believe, die up to today. We've had 63 children in the United States die of influenza-related causes. And they fired her for being out with influenza. That is what happened. This is an absence for influenza should actually be applauded, and perhaps you should get a bonus. And maybe CMS should be giving you that bonus because let's face it, if you're in there being Typhoid Mary, you're going to cause increased hospitalization, increased complications, and we're going to spend thousands, hundreds of thousands, or millions of dollars on additional hospitalizations, additional complications, because nurses came to work sick with the damn flu. What the hell is wrong with these people?
Well, you know,
I want to know.
Well,
what the hell is wrong with them?
Right. And there's a couple things rolling through my mind that I just wanted to get out. Like, you know, the first is, of course, the obvious of, like, the infection control standpoint. When you look at OSHA guidelines say that healthcare employees should be screened at the entry point of the hospital for signs and symptoms of flu. And if they are flu positive, they should be sent home, and they should have to get medically cleared before they come back. Now, mind you, this is not a requirement. Shouldn't this be a requirement?
It's a suggestion. Now, if you open a drink at the nurse's station, OSHA loses their effing minds. But if you throw 20 flu positive nurses into the hospital that night, they're totally chill with that. That's just a suggestion.
It's just a suggestion, right? And then how many times do you get thanked for coming in sick? I mean, I know that I've been thanked for coming in sick. I know you're sick. Oh, you're such a trooper. Thank you so much for coming in. No, it should be like, you need to get out. You need to go
That's how
home.
my boss at my current job is like, oh, hell no, go home. Because she would rather stay late and work herself than have anyone spreading flu around the department.
Mm-hmm.
Okay, and I think that you bringing up the OSHA guidelines brings us to our next point, which was the CDC needs to be involved with enforcing this. The CDC needs to make recommendations to the hospital that have implications toward Medicare reimbursement.
Mm-hmm.
That's what they need to do, because we're getting now. You guys know that I personally get my flu shot because I believe they work. So that's why I get my flu shot.
Mm-hmm.
Okay, so you don't have to believe that. Whoever you are, you don't have to believe it. It's evidence based, but whatever. So
Right.
if we're basing hospital reimbursement on flu shots, shouldn't we be also basing it on not working nurses with the flu to spread the flu to compromised patients, or to patients who are going to go back to other institutions and freaking kill people? People will die.
Well, right, and here's the other thing. Consider this. The Centers for Medicare and Medicaid Services, CMS, right? They have a never event list, and they're not reimbursing for conditions that occur that are on the never event list. So we're talking about hospital-acquired infections, such as from catheters, from central lines. So if I come to work sick with a contagious illness, such as the flu, which I love how you pointed out in your last slide, you pointed out that it's fatal, because it is fatal.
Yeah.
It's fatal.
It is a potentially fatal illness.
Correct. So if I come to work with that, and then the patients catch that, is that a hospital-acquired infection?
Well, not only that, but I believe that if you got it in your place of work, it was also a hospital-acquired infection.
In which
now,
place?
it might be an occupational hazard for us, and it kind of is. I mean, I was an ER nurse for years, and I know that if I didn't have the immune system of a cockroach, I would be dead. But yes, the patient has gotten a hospital-acquired infection from the staff at that point.
Right.
Why aren't we looking at that? And what's the answer? It's follow the money. We cost money. We don't make them any money as far as they're concerned.
Right.
So follow the money. And the only way we're going to change this is by hitting them in the pocket. And when I say in the pocket, I mean their reimbursement.
Well, that's exactly it. And I think also about like the medical errors. So medical errors are the third leading cause of death in the United States. And when we think about when we think about medical errors, we think about, oh, somebody gave the wrong medicine, they did the wrong procedure. Well, couldn't we count like our immunocompromised patients who end up, say, for example, dying of the flu that they got from a staff member? Isn't that a medical mistake? So how much bigger is that number really?
And also, what kind of medical errors are you going to make while you have 102.5 temperature and you're staggering around holding your head? I have no idea what your symptoms were, but with the flu this year, I had this massive headache and I could not think. And my boss came into the office. I was like, come here. And I was like, I think I need to go home. She's like, get out of here. Because I couldn't even think anymore. All right. So why have we gotten to the point here that all we care about is this policy in black and white? And why do we follow a policy that's stupid? Because this is stupid. It is stupid to expect anyone to come into work as a healthcare provider with the damn flu. Nobody should go to work with the flu, but certainly not people like us who are breathing on freaking little old ladies for 12 hours.
Well, that's it.
What are we thinking? And Theresa, by the way, you're going to have to be a guest again because I'm having like total fun with you right now.
Oh, I'm enjoying talking to you.
Isn't this fun?
It is.
It's just like a chat with friends, except for you have like other people commenting on it.
Right.
Honestly, Donna asks a good question. Do we trust the CDC not siding with the hospital? And yes, I do, because CDC has proven themselves to be very impartial with a lot of issues with hospitals. They're the reasons, the CDC is the reason you have gloves, actually. The CDC is the reason that you have needles that retract, safety needles. They are the reason, because before that, we used to shove them in the bench seat of the ambulance or the mattress of the bed because there was no sharps container. Okay, show my age. but yeah, how many errors due to overworked staff? Great question. Jennifer said, I would refuse a healthcare worker from working on me or my family if they were ill or didn't wash their hands. And we are allowing this to happen. You know why? Because we aren't doing what Theresa just did. which was go to the damn news and tell them what happened. So this is what I'm going to want you guys to do. I'm going to get a good phone number from Theresa, and we are going to call that hospital, and we're going to tell them exactly how we feel about what happened.
Fantastic. I love it.
Thousands of people, all of you, repeatedly calling that hospital to tell them how disturbed we are that they expected nurses to go to work with influenza. And what do they think is going to happen? How many people do you think that their nurses who have to work sick have passed flu on? How many flu-related deaths has your facility had this year, sir? I'm going to need to know that.
Right.
And that is what we're going to need to do.
I think it's an excellent idea.
I think we're going to do it tomorrow during business hours.
Okay.
And I'll live cast a few times during the day, keep everybody motivated about it. As long as this is okay with you, Theresa, because this is your life and your career, and we all know that there are very real repercussions. We know.
Oh yeah.
We do Nurses Take DC every year, and every year I wait to get fired. I do. I wait to get fired every year, but of course I'm like, a ringleader, so I'm, but you just turned into like a ringleader, so this is your circus and these are your monkeys. So at that point you become a little more, this is Flugate or Flugazi, depending on what we call it. We had Chairgate. We've had all kinds of different craziness. Chairgate was when we actually sent camp chairs to a nursing home who took away all the chairs from their nurses.
Nice.
We had Padgate, where we sent maxi pads to an Orlando high school because the kids couldn't get, where's my ship stirring hat? You're going to love this, Theresa. Hold on.
Oh, love it.
So we do things with Show Me Your Stethoscope. And one of the things we do is we advocate individually for nurses. And we like to advocate individually for nurses because it makes a real difference. And in this case, I'm going to tell you, Theresa, I would get a lawyer. I know you're an at-will state out there, right, though, aren't you?
Yeah.
Yeah. You're an at-will state in Ohio, but having said that, I think that they may settle because it's going to be such bad press for them. And honestly, I would like to help you with their bad press because they're a bunch of douche canoes. That's how I feel about it. Nurses taking care of nurses, says Kelly. That's what we do. Nurses take care of patients, and Show Me Your Stethoscope takes care of nurses because nobody else is taking care of the nurses. The ANA is not taking care of the nurses. The government is not taking care of the nurses. The Board of Nursing is there to protect the public from you, not to protect you. So who the hell else do we go to? And the answer is we have to go to each other.
Oh, yeah. And one thing, I didn't mean to interrupt you, Janie.
No, go. Believe me, I'm not.
I love your hat. You have to wear it tomorrow during the phone-a-thon. But,
I will.
Which I think is an excellent idea. One thing that I just wanted to point out is, this is really widespread. I mean, this started out as, my story with this one hospital. But I have to tell you that once this aired locally, which was a week ago Thursday, I started getting a ton of Facebook messages, and then on the news station's Facebook page, which was News Channel 5 in Cleveland, there were a ton of comments, and I would say about 90% of them were supportive, like, hey, this had happened to me, or I'm working under these policies. And then, of course, you had your couple of people that were like, oh, she probably, just called off all the time, and all that sort of stuff. But,
I was fielding those all week. That was bullshit.
Yeah, and it's disappointing, because, too, I think people get tunnel vision, and I know this from teaching clinical, because I go to all these different hospitals, and, a policy, for central lines in one place is not exactly the same as in the other, but everybody thinks theirs is right. And so, I have people that are like, well, but I worked at a hospital for 40 years and it wasn't like that. Well, then you're lucky, because I've been hearing for over a week now how many people are working under these similar policies. So, it wasn't just me at this one hospital. It's not just this one facility. It is all over the place. And, once the story got syndicated by CNN overnight, which was a week ago Friday, I woke up, I woke up that morning and I had, a message from my dad, like, oh my gosh, you're never going to get hired anywhere because I saw you on CNN this morning. And then during that day, I had friends from all over the country, different, people I've known through my life who were like, hey, I'm in Miami and I just saw you on TV, and I'm like, oh my gosh. And then I was getting even more people like finding me on Facebook and saying, you know, that this had happened to them. So this is widespread. This isn't just about this. So can I do just a small plug for my Facebook group?
Yeah.
So I started a Facebook group that I'd like to invite everybody to join, and it's you just have to search for it. It's a closed group, but if you just search for Excuse Sick Nurses, because what I'm trying to do with my Excuse Sick Nurses Facebook group is to kind of get people from all over.